You may be wondering, how long after giving birth should you have sex? Well, we're here to talk about it. I'm Dr. Perkins, a board-certified OBGYN, and I'm excited to talk about this topic with you today. Let's go. Today, we'll be exploring everything that you need to know about having sex after giving birth, how your body changes after having a baby, how long you should wait for sex after giving birth, and how soon you can get pregnant after giving birth. All right, so let's talk about having sex after giving birth. The process of giving birth is one that is beautiful, sometimes maybe a little bit traumatic, but it is a very miraculous process that happens, and one that really, I tell patients all the time, pat yourself on the back because you did a great deed. Giving birth places a lot of pressure and stress and causes a lot of changes inside of your body. Your muscles become a little bit softer. Your joints, like your hip joints, become a little bit looser. You've had a lot of increase in your blood volume. A lot has happened in the process of going from pre-pregnancy to having a baby. As a physician, our recommendation is really to give your body ample time to rest, heal, and recuperate after having a baby. We recommend 4 to 6 weeks of waiting. Now, we're speaking about giving birth. Giving birth can be in the form of a vaginal delivery or a cesarean section. Regardless of the mode of delivery, it is recommended that you wait at least those 6 weeks. As your body is healing, it is changing to go back to a pre-pregnancy form. Now, you'll never be exactly the way you were before pregnancy, but you can get pretty close to that. Immediately after baby is born, your estrogen levels that were much higher during pregnancy fall. They decrease. And because of that, you start to feel symptoms that are due to estrogen levels being low. For instance, you will have a tremendous amount of fatigue, overwhelming amount of tiredness. Part of that is due to the fact that you're tending to the newborn baby, you're not getting much sleep, you're probably not eating and drinking enough water, and all the things that are important for you feeling balanced. In addition to that, having a sudden decrease in your estrogen levels will cause you to be fatigued in and of itself. You may have other symptoms like vaginal dryness, similar to people in menopause. You may note that it is very easy for you to cry and become teary. You may also have pain with sexual activity or just have a decreased desire for anything sexual. These symptoms are all due to the sudden decrease in estrogens after giving birth. Physically, if you had a vaginal delivery, there were also a lot of changes that happen in the vaginal and vulvar area that really needs time to heal. Those changes include your vagina stretching and able to fit a human being passing through that canal. With that, it really takes many months for the vagina to heal well, for it to get back to its normal size. If you had a tear or a laceration down there, you really want to give your body time to heal that well so that you don't have any deficits or any problems having sex in the future or with your future delivery if you choose to do so. If you've had a C-section, you also had a lot of manipulation and changes down there. These changes are a little bit different because they're more in the abdominal and pelvic area. This requires time for healing. Healing may not just take 6 weeks in a C-section. In fact, healing may take 6 to 12 months to be completely done. Listen to your doctors and their guidance regarding how far along you are with the healing process and any adjustments that you may need to do in order to help your body heal best before engaging in sexual activity. Now, some people after giving birth may feel amazing by 3 to 4 weeks after. The question is it okay for me to have sexual intercourse once you're feeling great and you're not having any pain down there? I have the answer for you. But before we do that, if you are enjoying our conversation today, go ahead and subscribe to our channel. I'd also love to know if you have any comments on this video, so please leave that below. Now, if you are feeling amazing after giving birth and your body feels like it is ready for sexual intercourse, it may be okay to attempt sexual intercourse before the 6 weeks. There are a couple of things that I will caution you on if this is the case. The first is that if you start feeling pain, this may be a sign that your body is not yet well healed. Secondly, if you'd like to have sex before that 6-week mark, I recommend going to see your doctors a little earlier, just to get that clearance, have them take a look just to make sure that everything is well healed before diving in. If your doctors have cleared you for sexual activity and you're still having pain with attempts, you may take some NSAIDs like Motrin or naproxen, whatever you normally take for inflammation. You may also try some Tylenol to see if that helps prior to having sexual intercourse. If after having sex you note that you're having a lot of burning in the vaginal or vulva area, try adding some ice or a cold pack. This often will help to make it feel so much better. My last recommendation on this point is to always empty your bladder before sexual intercourse. This helps to decrease pressures and any influence of the bladder on the uterus and on the vagina. Now, I've also had a lot of people ask me, well, how is it going to feel after giving birth? Is it going to be the same? And my answer is that this is all individualized. And this is because the amount of birth trauma or changes that happens with the process of having a vaginal delivery changes from person to person. Most people with a C-section do not have the same experiences or the same problems vaginally after a C-section because their vaginas have essentially remained intact. In general, most women will say that their vaginas feel just about the same even years after giving a birth. Most women will say that their vaginas feel just the same as before they gave birth. Now, if you decide to have sex before the 6 weeks or even after, it is important to understand when ovulation returns. Oftentimes, women will tell me, well, Dr. P, I haven't had a period yet, so I'm not ovulating. And that is not quite the case. Ovulation happens before a period. Ovulation means the process of releasing an egg. Once the egg has been released, then if it dies in 24 hours after being released, then a period will come. Therefore, you may not see a period before you ovulate. This is important because somewhere between 3 to 4 weeks after you deliver your baby, most people will ovulate. That is the point where it's most critical and easiest for you to get pregnant. In that case, if you think that you may have sex before the time frame or anytime after you deliver and you're not ready for another pregnancy, which is also not recommended, but during that time it's probably good to be on some form of birth control. That may include hormonal birth control, non-hormonal birth control, or even using condoms. The most important thing is to have a plan in place so that pregnancy doesn't occur too soon and that we don't have an oops, which can lead us to another scenario. Your health matters, and giving your body time to heal after you give birth is very important. I have a free ebook that I would like to offer you today. To get this, click the link below and get more information. It's been a pleasure. As always, I'm Dr. P, and I'll see you in the next episode.